Soon could be as early as the next 2 hours. The national number of new daily cases have crept over 3,000 last week, up 50% from an average of 2,000 earlier in November. More than half of those we've mentioned, the increase driven by infections in the Eastern Cape and around 25% by cases in the Western Cape. Dr. David Stead is an Infectious Diseases Specialist at Frere and Cecilia Makiwane hospitals. A very good evening to you. Thank you so much for joining us. So the House Minister said the small cluster outbreaks which you are seeing are transient. In layman's terms, what exactly is this?
You mean to Pisa and to the viewers? Yeah, I mean, I think we're seeing more than clusters at the moment, especially in the Nelson Mandela Bay Metro and in BCM. I mean, I think they probably started as clusters. We saw, grumbling infections happening through the quieter months of September and October, but those have unfortunately, escalated quite dramatically. First in Nelson Mandela Bay, and then unfortunately. Buffalo City, where I'm based, seems to be following the same trend with quite alarmingly rapid rises in cases, and we're seeing it in hospitals with large numbers of sick patients flooding the hospitals again. So it's definitely a concern. Yeah.
But I wanted to understand what does the transient denote, and also if you could just tell us, in your observation, what has led us from less than 3 daily cases detected per 100,000 people between the end of August and the start of November to where we are now? We're talking about more than 3,000 cases per week.
Yes, it's definitely a concern. I mean, so the reality is this is a new virus. It hasn't even been recognized, globally for a year. So we're learning about it every day, and we're watching other countries. We're watching trends. And we, it was interesting how rapidly our first wave dropped down to quite low levels, and we wondered whether we'd reached some, levels of herd immunity that was causing that. So it's been quite discouraging seeing how it's taken off again in the Eastern Cape, clearly showing that there's lots of susceptible population. In terms of it being transient, I mean, others may know more than I do, probably do, but we don't really know. We hope this second spike that we're seeing in the Eastern Cape, isn't going to be long-lasting. We hope that there's less population that are vulnerable than the first time round. But definitely at the moment, the way it's spiked up is quite a concern. It does seem that probably super spreader events have caused this second spike in the Eastern Cape, and definitely in Buffalo City, what we saw in October, our first significant clusters of infections were among students, and clearly there'd been a lot of non-following of restrictions with parties, masks off, nightclubs not following curfews, and we saw some outbreaks in some of the student residences, and it does seem that a couple of weeks after that's now moved into the communities. Obviously, as students travel home, as they interact with family, that it's quite difficult to contain those localized outbreaks.
So, Professor Karim, saying that we are not in a second wave, but in the midst of a resurgence in the Eastern Cape and Western Cape. Practically, how does this distinction manifest?
I'm not sure, to be honest, about the exact definition of a second wave. I mean, I think it's in terms of the actual numbers, definitely nationally, it's, nothing like we saw the first time round. In terms of the intensity of cases, Nelson Mandela Bay has actually seen higher numbers of new cases per day than they did with the first wave. So it's quite localized, but intense, and so that's, that obviously the greatest with COVID is the impact on the hospitals and our health facilities' ability to cope, which is why we locked down in the first place. We've had obviously a lot of time to prepare, but the reality is that our hospitals are again at capacity and struggling to provide oxygen and beds for the number of sick patients coming in the front door.
Do you have numbers, particularly at Frere and Cecilia Makiwane, in terms of the uptick in admissions? And also, I know you mentioned some areas which, or districts which may be the source of the high number of infections, but are there any particular you're worried about, particularly in formal settlements as we head towards the festive season, the holiday period?
Yes, so it's just a correction. It's Frere Hospital, not Mount Frere.
Yes.
That's a different area, that's a different place in the Eastern Cape. I don't know the exact daily numbers, but we're seeing significant, similar to what we saw in the first wave, actually, in terms of number of patients requiring admission. What's a challenge for us is that we've got less space in the hospitals because of all the trauma that's very much linked to the free availability of alcohol. So that's been quite a frustration the second time around compared to the first wave with the hard lockdown. Just as an aside, in terms of where patients are coming from, quite a range. It's affluent areas. It seems COVID doesn't discriminate. Obviously, overcrowded township areas, it's very difficult to social distance. You've got 12 people in a single bed, in a single room dwelling. Very difficult to prevent any spread in that sort of a setting. It's at the moment, definitely in Buffalo City, it's most intense in sort of central East London, which does have a lot of informal settlements. But we're definitely seeing infections coming across the board. The private sector is actually completely at capacity, from what I understand. So COVID's really hitting all stratas of of the socioeconomic levels.
And how are the public hospitals then coping, especially with staffing? They've really been at it since March. And are you hoping that you could, rally for reinforcements in the shape of Doctors Without Borders?
I believe that Doctors Without Borders have actually been supporting Nelson Mandela Bay. They really were caught at a crisis with the second spike, and I understand that they have been providing some nurses and doctors to try and fill in some of their gaps. The one slight difference with the second surge compared to the first is that we're seeing less of our staff becoming infected. We have had staff infections, and that's always a concern. But fortunately, I think we had such extensive numbers of staff getting infected the first time round. We're seeing the benefits of immunity amongst the staff. So we haven't had, wards closing, and also the staff have been, I think there's been less fear the second time around. There's a lot of fatigue. There's a lot of frustration, and that's it's the last thing anyone felt like in December of a very, very tough year when everyone's needing a break to be having to scale up again and roll up our sleeves and put in extra hours. But we're fortunate at the moment. We're managing to staff our wards reasonably well in the government hospitals.
So, quick and final question before we let you go. Do you think localized hard lockdown in some districts is warranted? Would you think that will help you to at least stem the rising number of infections?
Yeah, it's a good question, and obviously we're all waiting for the president's address shortly. Obviously the balance is the economic versus the health, and obviously the two impact each other. Obviously the first hard lockdown, was extremely devastating economically and in terms of joblessness. So we're very aware of that it is a balance. I think they could not necessarily do the same as we did in level 1, but look at some sort of smart lockdowns, possibly non-economically essential activities. Definitely a big factor. You may ask, why is the Eastern Cape, the one province? Western Cape's following. That's seeing such high numbers, and I think our traditional funerals are a big factor. Anecdotally, a large proportion of patients that I admit with COVID report having attended a funeral in the last 1 to 2 weeks, and I think the control on funerals, I think maybe they need to bring down that number again. It went up to 100 with level 1, and other large gatherings. I think some sort of smart restrictions, it would help us in the hospitals if they restricted alcohol. How much they do that is obviously the debate. But I think we definitely need to look at reducing any super spreader events, reducing large gatherings, indoor gatherings, and really appealing to the public to be very thoughtful and careful about their socializing over this December period, to keep it as limited as possible to a smaller cluster, smaller a pod as possible, for necessary family gatherings.
And no doubt the President has not only been consulting the national but the provincial command councils on COVID-19. We'll see how that is reflected in his announcement later on. Thank you so much for speaking to us, Dr. David Stead. He's Infectious Disease Specialist at Frere and Cecilia Makiwane Hospital.